Hello, I'm here with Malcolm Beasley, the CEO and founder of PCI Medical. Malcolm is an expert in helping pharma companies create obesity education for sales teams and healthcare providers. How are you doing today, Malcolm?
Hi, Dario. I'm doing good. How are you?
Excellent. So let's just start. I know you've been in the obesity space for a long time. Can you walk me through your journey in obesity education, maybe where you started and how the role has evolved over time?
Yeah, we first started working in obesity in the late 1990s with WIAS or fenfluramine. And our first project we did was a CME project. Actually, if you remember the old the old giant
Yeah, yeah.
binding
Oh, yeah.
80 slide decks. So we did that. Early on, obesity was a very frustrating field because the weight loss that was achieved was not what was desired, and more importantly, the drugs that were available then had significant side effects, and so that kind of held the field back in terms of having uh, having the tools that they really needed to address the obesity crisis. So since then, the recognition of obesity as a disease has been a major milestone. Also, the board certification in obesity medicine has been a big sea change in terms of thinking about obesity. And then what's really transformed the field is the approvals of the GLP-1s. And these have finally provided very effective treatments, actually to the point where they're so effective with some patients that doctors have to decide how much weight loss that it's going to be healthy for an individual patient. So, and what's been really different about these meds is along with the very good clinical results, they also have limited side effects. So they've been able to really go a long way in addressing individual patient needs. And the field now is undergoing very rapid development, and with there's actually dozens of new agents that are under clinical trials. There are looking at additional mechanism of actions and also combining existing GLP-1s with drugs with different MOAs to get really effective results, and also moving from an injectable route to oral delivery.
Sure. So much easier. So I'm interested in learning more about the Obesity Handbook. I know you've been involved in that for a number of years. Tell us a little bit about, how it was created, how you created it, who you work with, and how it's used.
So the obesity handbook, we published the first edition in 2015. The KOLs that we're working with on the book as the authors are very well known in the field. Carol Apovian is a professor of medicine at Harvard Medical School and the co-director of the Center for Weight Loss, Weight Management and Wellness at Brigham and Women's. She's also a New York Times bestselling author. And Louis Aroney is a professor of clinical medicine at Weill Cornell, and he's director of the Comprehensive Weight Control Center at New York Presbyterian of Weill Cornell. And both Dr. Apovian and Aroney are past presidents of the Obesity Society. And actually,
Yeah, that'd be helpful.
let me share a copy of the book. So this is the third edition of the book, and we are disseminating it in conjunction with the Obesity Society. Um, the the president of the Obesity Society wrote the foreword for the book, and then there's also information about the group that's actually contained in the book. And the book covers really 95% in a very concise resource of what HCPs need to know to manage obesity. So it covers pathophysiology. It goes into very important concept, the complication-centric approach to managing obesity, which is to focus on the medical complications of obesity a little more than the cosmetic issues, because there's a lot of downstream effects of obesity, such as type 2 diabetes, that are important to head off if possible. And then importantly, we cover all of the available anti-obesity medications and actually every one of the clinical phase 3 trials for the GLP-1s, and in addition to covering diet, exercise.
And so this is an actual physical book, right, of several hundred pages?
It's an actual physical book, which is about 300 pages. We also have a ebook version of this that this is the web-based e-version. So the print book is also accompanied with a web-based e-version, and this allows viewing on the web, but also importantly, it allows users to download a PDF of the book onto their device.
And beyond this, Malcolm, what other educational initiatives or content have you developed? What other modalities have you used in order to really bring this type of education to life?
Well, I mean, we're a full service MSL and sales rep training company. So we produce resources in everything from a PDF to a narrated PDF to an iOS training app to videos, explainer videos. So really it depends on the educational need. This is an example of a training resource that we developed for a national sales meeting, where we had an iOS app that was basically a digital escape room, where we had two of the trainees. One would have their iPad, which had their detailed information on it, and the other one had the app, and they navigated through our app that we developed by answering a series of questions and puzzles that were based on clinical information that they needed to know in interacting with HCPs. And it was done in a timed environment where so there was actually competition between the different teams. And then at the end, when you finally located the solution, a horn sounded, and that indicated the end of the competition.
Interesting. So there are a lot of different ways that you've brought this type of education to life.
Absolutely. And then another way that we've done that is to utilize stock video, to utilize storytelling, stock video, and professional animation to tell a story of a patient journey, to bring that kind of the emotional impact of what a patient's going through to the reps, so they can understand on a more visceral level the importance of the work that they're doing.
So you had mentioned you'd created this for a national sales meeting. What are some other, I guess, situations where you're working with your clients to create whatever training for either MSLs or HCPs or salespeople?
Well, another big area that we're working on now is we're creating digital learning hubs, and these combine interactive, what we call clinical essentials information, along with KOL presented short video presentations. So how this helps is the way that we've been developing this is in Articulate Rise, and the reason we chose Articulate Rise is because it has a lot of easy to create interactive features. It's also mobile maximized, and it's also easy to deploy on the LMS. So we will, and finally, what's also important is that we can create pre, post, and within module testing. So it makes for a very engaging experience, whether it's for the learner or whether it's HCP facing.
Excellent. And can you just tell us a little bit about how you work with clients?
So we work typically. What we do is we will have an initial meeting with the trainer. Oftentimes, marketing is involved in that, and we basically listen at that first meeting to see what is the training need. From there, we will go back and develop both a concept, which will include a detailed outline of the content that's going to be covered, but perhaps just as importantly is the media which we're proposing to develop it. And that may include the use of video or other elements that we think will most effectively convey the what we're trying to get across. We go back, we present the concept and hone it based on the feedback received, and then from there we'll develop the timeline and the key delivery dates for the components, and then move forward with execution.
And you have a lot of experience working with KOLs. How would a KOL be incorporated into this process if needed?
Well, especially in obesity, the KOL is extremely important because they've been dealing with patients for many years. They know what works and what doesn't work. And they also know when we're doing HCP facing materials, they are out talking to family practitioners and internal medicine doctors on a regular basis, and they know where the learning gaps are with them and what needs to be clarified, because there's a lot to understand, and there's a learning curve around the GLP-1s, and it's important for HCPs to get as far along on that curve as possible. And to get that helps to keep people on patients and keep patients on medication, and also to ultimately achieve success. And that includes knowing how to deal with side effects that occur, to allow patients to continue on the treatment protocol.
Excellent. So this has been really informative, Malcolm. What's the best way for somebody to get in touch with you if they want to explore a potential need or a project?
Well, let me just show our contact information. The best way to get in touch with me is actually just to reach out to me directly. My email is mbeasley@pcimed.com. I would also encourage you to take a look at our website, www.pcimed.com, which we just finished updating, and that provides a really great overview on our capabilities.
Excellent. Well, thanks, Malcolm. That was really informative, and thank you, everybody, for your attention, and have a great day.